Hello, salut, buongiorno, and welcome to another episode of the Traveler's Haven podcast series, where we will be looking at all things true travel professionals need and need to hear. Once again, I'm Sam, and I'll be your host. In celebration of Nurse Week, we are joined by a pillar in the nursing community, someone who has mentored over 700 nurses and more. Let me introduce the Canadian RN licensure expert, Nurse Ofela. Hello. It's nice to have you on.
Hi. Yes, good afternoon. Nice to have you and nice to be with you today in the studio.
Nursafella is a registered RN in both Canada and Africa, helping her bring a global perspective to the nursing leadership roles she takes on. Aside from her proficiency in acute and primary care, Nursafella is also an expert in regulatory affairs and innovative care models, using her knowledge to help advocate for ethical nursing standards. She is a mentor to nurses across the globe and has worked within the IEN community to help people become their best selves. So I brought you on, have a couple questions. We'll go through them one at a time, and you can just speak to your heart's content.
Absolutely. Let's do this.
Awesome, awesome. So you have a lot of qualifications and knowledge for me to ask you about, but I figured it would be best for me to start basic. Could you tell my viewers a bit about yourself and your journey so far?
Yes, thank you very much for your question and thank you for what you're doing. I think it's very important that we're able to spotlight and showcase professionals across different fields and particularly in the nursing profession. It's very, very commendable. Ifeoluwa Olufela is my name. The name is kind of lengthy. So yes, people call me Nurse Ofela. We just shortened it to Nurse Ofela. Ofela as pronounced. Yeah, so I'm a Canadian RN and I worked in Africa, Nigeria, typically before I migrated into Canada. And my journey started from there. I started first in Canada as a licensed practical nurse, after which I also became a registered nurse. I didn't have to go to school for any of the two. I challenged the exam. I wouldn't want to go into too much details on that, so we don't waste our times today. So when I came into Canada, something stood out for me. It was the lack of information when it comes to the Canadian RN licensure pathways because I wanted information. I was searching for it. I went on Google, I went on YouTube, and there was nothing. There was nothing to show me what to do and how to go about becoming a registered nurse in Canada. So immediately I became a licensed practical nurse with my provisional license. That was a conditional license. It wasn't a full license. I took it upon myself to start posting information about my journey, how it's been going, how I do this. I established a community by WhatsApp where we had over 600, 700 nurses, close to 1,000 actually, and then where we provided free information. So we started all of that, and that was how the movement began. I speak on YouTube, I do TikTok and all of that. So basically, I just want to put out information every time I have one concerning the Canadian area licensure pathways. And that's what I've been doing. And I currently mentor in all of nurses, as they have mentioned. I also work with communities for IENs like CRIEC. What they do, they're in Calgary, and what they do is that they provide free mentorship to IENs across Canada, anywhere in Canada. They provide mentorship. I partner with them and I mentor some of their nurses right now. Thank you.
Okay. Yeah. Wow. Yeah. I know that you're a part of like a lot of separate, you do your own thing, but you also have like
Yeah.
many different like groups that you work with to help people. So
Yeah.
it is really commendable.
Thank you.
Uh, so is there anything specific that you got you interested in nursing, or is there maybe something that inspired you? Was there someone in your life? Just how did you get into nursing?
And for me, I know that a lot of people, when they are growing up, they see a mother figure, a sister figure that was a nurse. I didn't have anything like that. For me, growing up, it was just that I knew that I really loved to care about people. I really loved to pay attention to details. And so my dad had a discussion with me about what I want to do in life and all of that. And he told me that accounting was a big one then. People love accounting. Everybody was going to accounting and they were making it in accounting. So he told me to go into accounting. And I told him that I don't think I can do accounting because I don't like calculations. So I do pretty much well in most things by God's grace, but calculation is not my strong suit. So I said, no, I don't think I want to go for calculation. And then I'm kind of a spiritual person, sort of too. So I had a dream, and in that dream, God had told me that I'm going to work as a nurse. Or maybe work in the healthcare system. It could be a doctor, it could be a nurse. So I told him that I'm sticking to that I know I have a direction, and that's that I'm going to be wearing white. Because nurses wear white then. We wear white a lot. There was no scrub then, it was just white. We wear white. So it was against that, like, oh, why would you? I said, okay, just let me give it a try. So we gave it a shot, and I started my journey, and there we are today. So that's how I just started my journey as a nurse, and it's been blissful. I love it.
Obviously, you picked the right path, I would say, right?
Yeah. Yes, I did.
So, on sort of the reverse side, what is the worst case of burnout that you've ever felt in your field? Because I know that a lot of nurses experience at least once in their career, like a little bit of burnout. And how did you manage to work through it?
Um, Actually, I would say that at the time that I had a burnout would be when I was working in the healthcare system in Nigeria. The first time I've ever had a burnout, I was in the public healthcare sector. So being in the public health sector, we have two nurses maximum to 30 patients. So it was a lot managing 30 patients, and you're just, and sometimes people call in sick and you are the only one managing 30 patients. So it was a lot for me because there's so much I want to do, but I can't do it because I'm limited. I'm just me. Somebody is there calling for help. They want to feed. Somebody is there calling for their drugs. Somebody is there asking, do you know the result of my test? What is happening with my test? Everybody is pulling you, and you don't even know how to split yourself, how to split your day. So it was really a tough one for me before I found a way to, okay, what do I even improve things for myself? And then the second time I would say that I had a burnout was when I started working in a rural community in Canada. When I became a Canadian RN, it was pretty much difficult to get a job in the town. So I had to move to the rural community. And in the rural community, there was no healthcare assistant. Even up till now, we have no healthcare assistant at work. So it was draining for me to do my nursing job and still do healthcare assistant jobs and still do healthcare assistant function, shower for the patient, feed them, turn them, change their diapers, change their brief or their attends. It will take them for a walk. If sometimes they want you to scratch their back. So it was a whole lot for me. And then somebody is calling you for, I need water, I need ice, I need my TV, I need. So that was another case of burnout for me. But I think so. What happens that with time, I just grew to manage my time properly because we talk about this thing, but pretty much management owns the decision of when they want to employ or not. So I had to just find a way to manage my time. So there is always burnout in the healthcare system. That is the truth. I don't think we are ever going to go past that stage where burnout is no more in the healthcare system. It will always be there because we are always short. People come and people go in the healthcare system. The healthcare system is very chaotic, and it takes a lot of blood, water, your own strength to work in it. So we just learn to live and manage the burnout as it comes.
And I mean, nurses have to do like 500 different things. And honestly, the fact that you just have to work through it is like the hardest part, I would say.
Yeah,
So, yeah,
yeah. Because everybody wants you to give them their best. So somebody that is in pain wants your best. Somebody that needs psychotherapy wants your best. Somebody that wants to change their brief wants your best. Everybody wants your best, but how do you do? And sometimes you just lost a patient, you just bag them, you just wheel them to the mortuary, and that patient is calling you to say that I got the job. I'm so happy. You'll have to discharge me tomorrow because I'm so. And then you're trying to be happy for them, but again, you're trying to depart from that patient you just lost. So the healthcare system is a whole cycle of life,
yeah,
and it's really hard to balance it sometimes.
yeah. Wow. Yeah, that's great. Okay, wow. And so I guess this kind of goes hand in hand, but what is the best moment in your career so far? So a patient, maybe when you succeeded somewhere, just what really stands out in your mind is something that was like really put it all together.
So, like I mentioned, the healthcare system is very chaotic. I would say that I have best moments most of the time, and this is it. So, for every time you do something for a patient and they are genuinely appreciative, those are my best moments.
Mm.
because healthcare workers are not paid enough. Though they just increase the what they pay about nurses, we are grateful for that. But I tell you that it is still not compared to what I do. Like you're doing the job of 10 people and you're getting paid for one person. But that's a story for another day. So, but when a patient genuinely appreciate, because not all patients appreciate what you do. Some don't care. They don't care what you do, how you do it. They just want to come into the healthcare system and they want you to give them your head, give them your hand, give them everything. And so some of them that genuinely appreciate, and those are my best moments when the patient says, "Thank you very much. Thank you for taking care of me." And some of them, care to ask, "Are you coming tomorrow?" Because they enjoy how much you've taken care of them today and they want to see you again tomorrow. So those are my best moments. Those little thank you, the little appreciate you. And some of them even ask you, how are you? Have you eaten? Are you going for break? I think just about maybe 2% of our patients ask us if we have eaten. The remaining 98%, they don't care about you. They just care about themselves and what they want at that time. So those are the little moments that are my best moment for me. And then when we succeeded to, somebody that is going through a lot, you succeeded to make them smile. You succeeded to make them see another reason to live. Those are my best moments as well. When we resuscitate a patient, they come back to life. Family are so grateful that they get to live another 6 months or 8 months or 1 year with them again. So those are my best moments in the healthcare system.
Yep. Yep. Honestly, I don't have anything to say. I totally agree. It has to feel like really awesome whenever you have someone that you're like, yep, I saved them.
Yeah, absolutely.
So, now you aren't just an experienced nurse. You're also an expert in innovative care models. So, for my viewers, could you outline what innovative care models are and how they're used to help in the healthcare field?
Innovative care models, typically what they do is that they improve patient outcome. They help us with better coordination in the healthcare system, and they help us to optimize resources utilization. So what that means is that we approach and we adopt new approaches per time to enhance our service delivery and then enhance our organization generally for the patient. So the models are team-based. Some of them are patient care approaches and the use of technology. I am a fan of there is something we use very often in nursing, which is evidence-based practice. I am a fan of evidence-based practice. If I wasn't going to be a nurse, maybe I would have been a lawyer because I love everything that is evidence-based. I usually tell my friends that if I ever accuse you of doing something, don't argue. I have my evidence before I accuse you of that thing. I always move with facts and figures. And that's one of the things I think is making me to thrive as a nurse because in nursing, you need your facts and figures together. So innovative care models are when we are putting those facts and figures together and we are adopting new styles, new innovations, new care models to just enhance because the whole total of the healthcare system is making sure that every patient get the best of care. Even if they are going to is going to be a peaceful death, I still want you to get the best of care onto your peaceful death. So that's pretty much the innovative care model. And we have the collaborative care, you have the patient center medical, or you have the telemedicine, accountable care. But I think so far so good. Collaborative care is one of my best because collaborative care is bringing together the primary healthcare providers, mental health specialists, and bringing together pretty much every specialist that you need as the patient to thrive at that time. And that is one of my best because one, it opens us to a world where the patient have a better chance to live to see another day. If I'm managing you alone, there are things I may not see. But if I'm managing you with another expert, I'm calling the mental health to say, this patient has a flat affect and I'm worried about them. Is there something we can do? And the mental care expert comes in to say, let us do this, let us do that. That is going to improve my outcome with you tomorrow. But if I've been managing you alone and I'm just the only one doing it, I might not stand a better chance at making sure that you see the next 6 years or the next 6 months even. So collaborative care is by far my best. And it's also one of the ways that you learn because nursing is continuous. I can't tell you that everything I learned in school now, I remember them word for word. But because nursing is continuous and is a word where you see things practically, I'm able to still put things together. So collaborative care is always my best because it brings together the team. Even if that person is your enemy, because everybody will not be your friend, that's the truth, you still have to work with them collaboratively for that patient. It means that even if I don't like you or not on good talking terms, we are here for the patient and that's the person that matters. And we are all going to work together for that patient. So for that reason, collaborative care is always my best form of innovative healthcare because we are bringing in all the experts. Yeah.
Okay, that's all. You actually somewhat answered my next question. My next question was going to be what your favorite care model would be, but I'm actually going to switch it up a bit. So it was collaborative care. How do you think that it could be implemented better? Because it's obvious it is something that is implemented, but how would you go about trying to make this something that, every hospital does to the best of their abilities?
I think for us to have the best of collaborative care, it begins with us as human beings. Because getting a team together is not just about bringing them together physically. It's also about the mindset. How do I put it now? Because I mentioned something the other time when I said that even if we are not best of friends, we are coming together for this patient. But the healthcare system is so dicey such that you have best co-workers, you have best friends at work, besties at work. They move in cliques. So some cliques are saying, no, 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 that clique is not my friend. That clique is saying that clique is not my friend. So I think that in the healthcare system, if we tend to, the healthcare system is we have more of women in the healthcare system. And because we have more of women they are wonderfully made such that we have some significant characters that may be affecting our care in a way that we don't know, which is the fact that team spirit. So if you have more team spirit in the healthcare system, I believe that we'll be able to launch more collaborative care. And another thing will be that there should not be a write-off. Like, some healthcare facility feels that because you're coming from Nigeria or from Africa as an healthcare personnel, you don't know as much as they do. I think we should erase that bias. There is always something good about a particular place. So if you're coming to me from, let's say, the ruralest part of the head, where people don't even speak English, I want an healthcare system whereby I'm able to say that, what is that beautiful thing in that place that I can learn from you? And then I take that from you, I shove away whatever bad I've heard about you, and then we come together. I pass my good to you, you pass your good to me. So I think that as human beings, because even when we have technologies in the healthcare system, human beings control technologies. I have to control my X-ray system to see what is really happening to the human body. So I believe that if I have more team spirit in the healthcare system, then we will be at the peak of our collaborative care. Yeah.
Yeah, I agree 100%. I know that you are also an expert in nursing licensure, and I wanted to devote a bit of time to talk about the cross section between the topic and immigration. For any nurses outside of Canada, what steps do they have to take to practice here?
So that question, I think that question is what I get asked every time I have interviews, every time somebody meets me, even when I go for, sometimes I go outside of my province for awards, organizations, and people just, oh, you're Sophia, I see you online. And that is the question they ask me every time. But it's all right. So I think I will have been a billionaire if I get money every time they ask me this question. So what I tell nurses is that Canada is different from every other country. Canada is different from UK. So in United Kingdom, they pretty much have a system in place where they're able to sponsor nurses in. And I think nurses are making that mistake to think that Canada also may be operating in that region. We don't. So we only had Abara Health Service started sponsoring nurses in about a year to 2 years ago. There was nothing about sponsorship before. And this program is wrapping up. They're not doing it as much as before. And even if they're doing it, everybody will not get lucky with sponsorship. So I tell nurses, take away anything sponsorship from your heart if you know that you're coming to Canada. You have to be able to do things yourself. So you pretty much need to have two plans. You need your immigration plan, you need your licensure plan. The immigration plan is a plan you have to land in Canada as a permanent resident, as a student. Do you want to land there as a are you coming under your spouse for a spousal open work permit? Are you coming under the federal skilled workers? That's the express entry. You have to find a route. Are you coming here to study? You have to find a route that makes you stay permanently here, sort of, if you can. It's not the visitor's route because some of them tend to come here as a visitor, and then they feel that when I stay here for 6 months, 1 year, I can get a job. You're not going to get a job that will pay you as a visitor. They're only going to get a job that will use you. So you need your immigration plan, you need your licensure plan. So Canada has over 100 immigration pathway. You need to look at those immigration pathway and see. I have a lot of video on my channel, on my YouTube channel, talking about immigration. You can check them out. They are free resources. Check those immigration out and stick to one or two or even three that can work for you and run with it. I also do mentorship. If you're interested in that, there's a link in my bio for my mentorship. Then after you sort your immigration up to 60 to 70%, you will now launch your licensure plan. Because I don't want you to get into Canada and they are also struggling to now become registered. For example, if you come in as a student, that your course is for 1 year, and then in the next 6 months that you're in Canada for a 1 year course, you are still struggling to become a Canadian RN. That is at a detriment for you because you wasted 6 whole months. So I expect that before you land in Canada, have your licensure plan, but don't launch yet. So you can launch it when you're about to enter into Canada. Create an account. It's very simple. We have 10 provinces in Canada. Any of the provinces you think you'll be arriving in, at least the first 1 to 2 years in Canada, create an account with their regulatory body. The process is always on their website, but sometimes it can be tricky. And that's why I come in to give you the best guidance and the best advice. Before now, we were starting with what we call NNAS, which is a National Nursing Assessment Service. But right now in Canada, it is no longer a must. So if you don't have a guidance from a nurse expert or a nurse mentor, you may think that your starting point is NNAS and then you waste 1,000 CAD on NNAS when you can always seek mentorship on that. So the provinces are 10 of them. You have to pick one of them, register with them, and that's how you begin your journey into Canada. But pretty much have your immigration plan and your licensure plan, and you'll be fine.
I have like a small little question connected to that. Is it different per province or
Yeah.
is it pretty much the same? It's different per province. Okay,
No, no, no,
okay.
no. So every province in Canada, we have 10 of them. Every one of them, they are different in their licensure plan. And that is why Canada is tricky. And that is why there was no information when I came in 2019, because some of the nurses that are already here at that time, they don't even know how to explain it. It's not like they are wicked. They're not wicked to not put out information, but they don't know how to even explain it so that you understand it. Because Canadian licensure is very tricky. You are reading and you're like, I don't even understand where to start from. What is all this gibberish? It is that tricky. And that is where I come in to make these videos, to make them simpler and to give you the guide. Yeah. So there are different pathways in 10 provinces. They are all different.
Okay, okay. And what are some of the most common challenges that you think nurses will face? Is it just the immigration? Are there like some unexpected ones that you wouldn't think would be a problem, but then it just is a massive problem?
One of the problems that nurses face when it comes to Canada, the practicing here is immigration. Immigration is one of the biggest problems. I had a program in March. It was a boot camp where we merged immigration and licensure together. So I collaborated with immigration experts in Canada. I don't know if you know, there are people we call licensed immigration experts. They are certified by RCC to give immigration guidance. So I partnered with them. They came for the program, put nurses through, and then I handle the licensure part on the second day. So the immigration part is always a problem when it comes. I'm trying my best in that regard to merge these things together so that we have more information in that regard and nurses can, and so far so good. We've had a lot of testimonials. I post testimonials regularly on my page of people that are under my mentorship. And if you want to do it by yourself, by all means, everybody is free to. Google is there for you to get a guide. Then another challenge I think internationally educated nurses face when they now come and they become Canadian RN is integrating into the system.
Mm.
The nursing practice in Africa is different, or even in Japan, in Europe, anywhere you're coming from, is different from what they do in Canada. Especially if you're not coming from a developed country. You're coming from maybe a third world country and all of that. The nursing practice is very different. The gap is so wide. So integration is all of the problems. But right now, I have programs in place. Some will come up where we can, do lab simulations for nurses, where we can do hands-on for them, because that's one of the problems they have. The integration system, the way procedures are done, they kind of struggle. Though there is orientation, but the orientation may not be enough sometimes for 2 months, 3 months. And the fact that sometimes the older nurses are not so open to teach the younger ones come in, teach without being biased, because I can teach you and still be biased. You can ask me a question. I tell you that you've been practicing nursing for 10 years. I expect you to know that. And then you tell me the answer. That is not how to teach. Because that way already made me feel bad that I don't know it. So if I tell you I need an answer to this question, you tell me that, oh, I can show you how to do it. This is how we do it here. You made me feel safe. Next time I'll come to you. But if you start with saying that you expect me to know it and I don't know it, and then the next minute I'm hearing the gist from co-workers that I don't know how to do this, or even from managers, then there is a problem. So I think that's one of the strains we have. The fact that older nurses here are not willing to really put the younger nurses through, and some of the biases, racial and all that. Yeah.
Okay, yeah. So we've already talked about this a bit. We brought it up a bit during the interview, but you also do one-on-ones, consultations to help aspiring nurses reach their goals.
Yeah.
So I was wondering what some of the consults would look like. What do you normally go through? Just give me sort of the basic steps that you go through with a consult.
So with my consults, I try to and with my type of person, I try to do my things very differently. And I try to, there's something I tell my people, which is the fact that I like value a lot. So if I'm doing anything, I'm trying to find value in it personally. So whatever program I have, I also want you to have value in it. For example, this interview, when I got a call for it, I'm looking at what value am I going to pass to people through this interview. If it doesn't have any value to pass to my audience or even to your audience, there is no point for us to do it. So in my consultation, I bring in value. So I do a one-on-one like this with the individual where I find out where you are, what you're doing, and then so when after that, I give you an action plan. So the action plan I have always have 2 to 3 mapped out options, and then we walk through it together. So I give you assignment to say that, okay, after this call, your first assignment is to do this, and then you give me a feedback. So after my calls, I also do something that is very unique, which is the fact that I give you 15 days free access to me to come back and ask me your follow-up questions. Because the Canadian licensure is so tricky. I don't want to just want you to pay me whatever you're paying, because my consult to start with is actually very affordable. I don't want you to pay me that and then you are still stuck and you're still confused. So after that, I give you 15 days free of charge to have an access to me to ask all your questions. I have a WhatsApp hub for that, which is strictly for my mentorship. And then after the 15 days, if you feel that, oh, no, so fella, I still need to stay under your guidance, then the group is monthly based subscription. You pay the monthly based subscription. I help you. We keep achieving your goals together. So all the 3 options or 4 options or 5 options we'll have, we'll go through all of it. You give me a feedback weekly, monthly, daily, anyhow you want it. I'm always available. And then we'll crush those goals together. And pretty much that's how we've been doing it. We've had a lot of testimonials. A lot of nurses are migrated to Canada through that channel. So yeah, it's been going on fine.
Yeah, I've seen a lot of the testimonials. I've seen them posted. A lot of the people come back to you and say that, I got it, I did it. So
Yeah.
yeah, great work.
Yeah. Yeah, the it's really been working. The strategies we have in place has been working so far, and they are proven to work. So that's something about doing things on your own and doing things with a mentor. Because as a mentor, I have proven strategies already that are already in place. All I need to do is that when you book my call, I plug you into the proven strategies and we work together. Yeah.
Okay, and where can people find you? I know that you're on Instagram, but do you want to, plug some places where people could look into it?
Yes, I'm on Instagram. I have a YouTube channel, I have a TikTok page, I have a Facebook page, I have LinkedIn. I'm pretty much everywhere. But if you want to book my call, the link is in my bio. On my TikTok is also on my bio on Instagram. I think it's also on my YouTube as well. So I'm pretty much searchable. And if you use your ChatGPT to search about me, you will see a whole lot. I actually didn't know that ChatGPT had a lot of information about me until about recently. Somebody just sent to me randomly that they were asking ChatGPT about me. So if you have ChatGPT, you can also get information about me on ChatGPT. Yeah.
Okay. And then it'll also be in the description of this podcast. So anyone who's watching, you can go down there and check it out right now.
Yes, I can give you the link afterwards. Yeah. Yeah.
Yep. And so, last question. Is there anything you'd like to say to any budding nurses watching that you would wish you'd known yourself?
Um, I will say of course I have what to say, but honestly, I won't say there are things I wish I didn't know. There are things I knew that I put in place that I think average nurses are not putting in place, or they are not putting it in place enough, which is the fact that one of them would be put yourself first. I understand we want to care for patients. I also care for my patient. I understand that. See, there is something in the healthcare system. It just keeps drawing you in. Once you start it, you just sometimes you tell yourself, I am done. I'm going to resign tomorrow. And then that tomorrow, people see you at work already down with your makeup and they're like, you're back. Something just draws you in the healthcare system. But I think we forget ourselves a lot of time. We forget our self-care. So I would say that whatever you love to do prior to becoming a nurse, that gives you happiness, don't ever stop it. Because a lot of my colleagues, a lot of nurses have neglected that part of them. That part of you that makes you joyous. Because the healthcare system is full of chaos. If you take in too much of those chaos, it affects you. You won't even know that it's affecting you. The things you love to do, you don't do them anymore. When you are off work, you just want to sleep on your couch. That is not how to live your life. That is not how I want you to live your life. That's not how I want nurses to live their life. For me, I love to look good. I love good hair. I love good clothes. So when I'm off duty, sometimes I intentionally just put on my makeup and take pictures and post them. I'm not even going anywhere. Those things make me happy. So I try to maintain that part of my life. And then just basically looking good. I love to attend parties. So I tell my friends, if you want me to come to your party, give me 2 to 3 month notice so that I can arrange my roster and be able to come to your party. But if you're somebody that loves to attend parties and then because of nursing or you love to do one thing, you're not doing them anymore, you are not living. I want nurses to live. Live your life. Sometimes we go hungry, 12 hours, no food, because we have patients to feed. I want you to take your break. I take my break intentionally, except when it's so cumbersome, which is even if it's 10 minutes, grab something to eat. As much as I'm taking care of this patient, I also have a kidney that needs to function. I have a heart. So if I deprive myself of water for 12 hours, what happens to my kidney? One day it's going to shut down while I'm managing other people's kidney. It doesn't make sense to me. If I go to do nursing, I'm also doing nursing for myself to be knowledgeable about the human system. Now that I know it, I'm not using it to my best advantage. That's a sin. So I want nurses to take care of themselves more. Put yourself first. Sometimes you want to go for a boat cruise or something. Tell them at work you need a mental health break. I didn't teach you that. But just you need something to refresh your memory from the beeping calls. We just hear calls in the dreams because everybody keeps calling with the bells. You need to have a life. And then another thing is that I would like to say is that we need to be out there more. So we need nurses to be at the forefront more. Don't be scared. I know nursing school kind of boxed us in and they make us feel that the most important part of our life is the patient. I understand the patient are very important to me, but if you have a gift, you need to stand up to that gift. You need to use that gift. You need to let the world know about your gift. You can be a nurse and still be a singer. You can be a nurse and still be a great writer. You can be a nurse and still be a great actress or actor. So I don't want you to just be a nurse and that is the only thing that is most important in your life. Some of your soft skills, bring them out, do them, live life. Basically, that's what I want to just tell nurses. Live life and don't subject yourself to workplace bullying. If you ever experience workplace bullying, report it at the instance and seek help because we have a lot of problems in the internationally educated nurses world right now. They are bullied at work. They are going through panels. They are going through disciplinary action at work. They are being disciplined at work. And the problem I have is that they don't come to me on time. So if you have any slight issue, find me on social media if you can't undo it. I probably know how to undo it because I've kind of gone through everything. So just find me, let us work together. So that's it. Thank you.
No, that's great. And yeah, nurses, it's funny how, if you forget yourself when you're a nurse, eventually a nurse will have to take care of you. So the best thing you
Exactly.
can do if you want to help people is you help yourself.
Yeah, exactly. That's the right word. Help people and also help yourself. Live life. I don't want to be at 60 years and going for a boat cruise and falling asleep in a boat cruise. I want to do my boat cruise now. So that when I'm 60, I'm probably resting with my grandbabies and I'm not really like, oh, now that I have time. No, there is always time. You just have to create that time for yourself, even while working in the healthcare system.
Yeah, yep, absolutely. Okay, that is perfect. So that's about all we got. Uh, Honestly, amazing. Thank you for being on the show so much.
Yeah.
And to all my viewers, make sure to follow. and check out all the links because especially during Nurse Week, you got to show your support. Show your support
Yes,
the best you can.
absolutely. Absolutely. Thank you so much for having me today. Thank you.
Yeah, no problem. And I've been Sam. This has been Traveler's Haven, and I wish you safe travels.